We're live.
Good afternoon. This is a bill hearing from the House Judiciary Committee. We have 5 bills that we're going to be hearing today. We're going to be hearing Senator Lee's bill first. This is Senate Bill. We'll give her a chance to connect via audio. This is Senate Bill 134. Senate Bill 134 is Senator Lee's bill. She is joining us there. We will hear from her for 3 minutes regarding Senate Bill 134. So please, Senator Lee, go right ahead.
Yeah, thank you, Mr. Chairman. This bill is a police training bill to account for the new types of stalking crimes occurring in this 21st century. The bill passed JPR in the Senate unanimously with a friendly amendment to clarify the scope of the training requirements. And under the bill's language, as you see before you, the police are merely required to know enough to pass along the info for the victims to request additional assistance and to identify and preserve digital evidence instead of actually having to document the digital evidence themselves. This is, of course, a companion bill to HB 148 that passed this committee to further update the definition of stalking in Maryland. That definition update will include the use of these tiles and AirTag devices that can monitor people in nefarious ways under the crime of stalking. This training component is essential because police agencies such as state troopers that might not have as much training in the crime of stalking would now have many more interactions with this new type of violation. The basic understanding of crimes and their elements are training components under the Maryland Police Training and Standards Commission. However, noticeably, stalking is absent from those requirements, and the added complexity of electronic stalking makes the issue even more ripe for review. Police, they don't know what to do in most circumstances when approached with the digital evidence of stalking. And there are many factors to weigh in when giving victims info, such as how to plan for digital safety and not to alert your stalker to perhaps escalate even further violence. And during the summer, I reached out to Eva Galprin from Electronic Frontier Foundation, who is the leader of a multinational effort to connect technology experts, domestic violence programs, and police together for trainings. There are materials available at the state and national level for police and training commission to reference for their trainings, and we have been assured that the commission can implement this without any additional resources. The individual law enforcement agencies would have to provide trainings, but they could go online and be linked from existing programs already set in place. This, of course, is a very important issue because stalking usually occurs and leads to more serious crimes, and the perpetrators may have an unusually high ability to avoid police detection if the devices they're using are beyond the training capacity of the line officers. This is not a bill to train police digital forensic officers, rather the Senate amendment that made it more clear. This is just about basic training so victims can get the information they need to protect themselves. This is similar to the hate crimes and human trafficking police training bills that have recently passed the General Assembly. For these reasons, I respectfully ask a favorable report on SB 134. Thank you, Mr. Chairman.
Thank you very much. Are there questions for Senator Lee? Seeing none, we thank you very much. And that concludes the testimony on Senate Bill 134. Thank you very much.
Thank you, colleagues and Mr. Chairman.
Thank you. Senate Bill 83 is next with Senator Kagan. Senator Kagan is here and we'll have 3 minutes to present Senate Bill 83. I see you there. Go right ahead for 3 minutes.
Thank you, Mr. Chair. 3 minutes for a bill you've not heard before because there's no cross file is going to be a challenge. So I'm going to talk really fast, I guess. Senate Bill 83 is one of the recommendations as part of the 911 commission that I've chaired for the last 4 years. TDOS and DDoS are when 911 centers are jammed. And if your house is literally on fire, or God forbid, grandma's having a heart attack, and you get a busy signal and you get no one who can answer your plea for police, fire, or paramedics, that's a problem. This bill will finally make that a crime. TDoS is when the telephone systems are jammed and someone either sets up robocalls over and over and over and over. And so the phone calls to 911 literally can't be answered. DDoS is the same thing through digital denial of service, through blocking people's ability to text or otherwise connect with 911. Maryland is I have to give a shout out to not just Senator Riley on the Senate side, but Delegate Krebs, Delegate Hill, who succeeded former Delegate, now Senator Jackson, whose birthday is today. And this isn't exactly the format of the bill as I would have preferred, but something is better than nothing. And it at least criminalizes and makes it clear that don't mess with our emergency systems, especially when we're talking about Russia being at war and possibly using cyber terror techniques. Certainly shutting down a 911 center in any of our 24 jurisdictions, it would be a pretty effective way of disrupting our quality of life. This is not hypothetical. Baltimore City's 911 system was hacked. For 17 hours, it was unavailable. Across the nation, there are over 1,000 attacks per day, with the highest of 8,825 in 2021. As you all know, the Department of Health had a cyber attack, which cut down COVID information, vaccination records, licensure of nurses, and much, much more. So as amended, colleagues, the bill would apply existing laws, penalties. Again, this isn't quite as comprehensive as I might have wanted, but it at least says there's going to be a consequence if you mess with our 911 centers. And so so with that, I will happily take questions. That's as speedily as I can offer it for you. So thank you, Mr. Chair. And I don't see the Vice Chair, but congratulations to the Vice Chair. It's nice to be with you all.
You had a whole nother 15 seconds. It's a lot, but it's all right. You did fine. Are there, yes, show us the book. Are there questions for Senator Kagan for the Vice Chair of EHE? All right. Well, we thank you very much. And that concludes the testimony for Senate Bill 83. Thank you very, very much.
Great to be with you all. Thanks for your consideration.
Right,
Bye.
no problem. Senators Heddleman and McCray are in other House committees. So now we're going to Delegate Jones. Delegate Jones, we're going to hear from her, from Gavin Potashnik and Lisa Jordan. 3 minutes for Delegate Jones, 2 minutes for Mr. Potashnik, and 2 minutes for Ms. Jordan. Delegate Jones, this is House Bill 1402. Ready to go?
Ready to go, Mr. Chair. Thank you.
Thank you very much. Go ahead.
Thank you. So this bill would allow for the altering of the statute of limitations for prosecuting sexual offenses committed by a healthcare practitioner. It would require that healthcare practitioners who have reason to believe that a patient is being sexually abused by another healthcare practitioner would be required to notify the head of the hospital, the patient, or a guardian or designee. And it would also require reporting, it expands the statute of limitations for reporting that sexual abuse.
All right. Brevity is appreciated. But let's then hear from Mr. Potashnik then for 2 minutes. And then we'll look for, and we're looking for Lisa Jordan. So we'll hear from you, Mr. Potashnik, for 2 minutes.
Thank you, Mr. Chairman, members of the committee. Gavin Potashnik, Deputy State's Attorney for Harford County, and I thank Delegate Jones for her leadership on this bill. As she indicated, what this bill would do is approximately two things. One thing is it would require a mandated reporting for other healthcare practitioners if they witness sexual abuse upon patients. And number two, it would extend the statute of limitations to 3 years for healthcare practitioners who commit a fourth-degree sex offense during the course of their practice. In looking at this bill, it really started with an issue we had in Harford County where we had a patient who was sexually abused while she was under anesthesia and nobody said anything. It was a true fourth-degree sex offense. And once she came out of anesthesia, a couple of years passed and she was unable to find a remedy and justice for that person because no one said anything. That's a travesty of justice. And I think it's something that really should be remedied by legislation. But this is not the first time this has happened. In my time as the working in sex offense for most of my prosecutorial career, this is not a new type of thing. Both in the city, there were two separate instances, one involving a doctor who committed numerous fourth-degree sex offenses, not worse, on unsuspecting patients, and he filmed it all. And that doctor wasn't discovered until years later, and no one said anything while it was going on, even though the people in the room knew about it, the other healthcare practitioners. Additionally, there was another individual who was a doctor who also did the same thing to unsuspecting low-income patients at a clinic. And that doctor was only discovered after we had put out an ad to find more people, and it went back on years. He had home health nurses that were helping him, and nobody said anything. It's about time that the legislature acted in order for there to mandate people saying something so that justice can be done and that people can be held accountable. Statistics for this kind of thing is really difficult to try to nail down. There's been national statistics that seems to be stymied by people not saying anything, or even patients not even knowing they've been sexually assaulted. This can be remedied. I'm asking for your support, I'm asking for your help, and I'm asking that you have a favorable report to House Bill 1402. Thank you.
Lisa Jordan, please, for 2 minutes.
Thank you, Mr. Chair, Mr. Vice Chair, members of the committee. I'm Lisa Jordan with the Maryland Coalition Against Sexual Assault. We're also here in strong support of House Bill 1402 with the sponsor amendments. I echo the statements of my prior panelist and just want to remind the committee of the horror of Dr. Nasser and the gymnasts and all of the over 300 women who thought they were receiving medical treatment and were not. They were being subjected to sexual abuse. Many of these women would not actually be helped by this bill because this bill provides only 3 years of time to press criminal charges. Some, of course, could charge rape, but for others who are touched but not penetrated, they really have no more than 1 year. And 1 year is simply not enough time for many patients to recognize that they have been subjected to sexual abuse. I'd also just like to highlight that this bill not only requires reporting, so if a professional sees that someone else has committed sexual abuse, that they report it, but also importantly, that they tell the patient, because you may not understand that an ungloved hand is inappropriate or that a particular type of an examination is really unneeded. This is a necessary amendment to our current laws. It will improve access to justice and also help prevent sexual assault. And so we urge a favorable report on House Bill 1402 with sponsor amendments.
Questions for the panel. We'll start with Delegate Shetty to begin.
Thank you, Mr. Chair, and thank you, Delegate Jones, for bringing this important bill. I have a couple of quick questions. Does this bill apply narrowly to providers who are practicing within hospital settings or beyond that?
So beyond that, thank you for the question, Delegate Seti. So it's within a hospital, but it could also be your private practice. It could be an inpatient facility, anywhere where a patient is receiving care, where there's an opportunity for a practitioner to potentially misuse their position.
Okay, thank you. And I know that you worked with the hospitals on some of the language, but I don't see testimony from them. Where did they come down?
So they ended up, initially they had some opposition, and all that they asked, so one of the first sponsor amendments was to include notifying the head of the hospital or hospital administration. Initially, the bill just required the notifying of the patient and or the patient's guardian if they were underage. And so they were satisfied with the amendment to include that the head of the hospital or hospital administration or head practitioner should also be notified.
Contemporaneously, not in lieu of, but also. Yes. Okay, got it. And then my last question, and maybe this might be appropriate for either Mr. Potashnik or Ms. Jordan, but I believe that there is already existing law around mandatory reporting for nursing homes. And I'm just wondering if you can share what that existing law is, because this is pretty similar as I understand it.
And that's right, Delegate Shetty, thank you for your question. There is existing law for mandatory reporting for nursing homes with stuff happening in nursing homes. There's also an additional reporting requirement for stuff happening in mental health facilities. But there's nothing out there for general reporting requirements for everything else. This bill does not create, or it does not provide, is not in conflict with those two other reporting requirements. It adds to the reporting requirements. It doesn't take away from that. But it really creates a new dynamic for everybody else because, I think it's time for that.
Yes, I completely agree. And thank you all for bringing this bill. Thank you, Delegate Jones, for your leadership.
Are there further questions? Can one of you remind me what the penalty is if they don't report?
So, Mr. Chairman, there is not a penalty for if they don't report. I think initially when the advocates were looking at trying to do this, we initially modeled it after the legislation that mandates reporting for minor abuse. And I think that was kind of nixed at this point, and it just makes it a general mandatory reporting requirement. There doesn't appear to be any penalties to it that we added to it. Certainly can add one, but I know that both the doctor and hospital lobbies wanted to keep it without penalty and make it a general reporting.
I guess I have some more questions now that I'm looking at it a little closer. So it's anyone who is licensed, certified, or otherwise authorized under the article to provide healthcare services in the ordinary course of business or in the practice of a profession. That seems incredibly broad. Would that include, I guess, a podiatrist? I mean, we don't deal with the licensed healthcare providers here in this committee, so I guess I'm going to need to go and look up who that it would include. But could it conceivably include a physical trainer?
Well, it's any occupation. It's under the Health General article. So I don't believe that a physical trainer is under that listing. A podiatrist who is an MD would be. So any category of healthcare practitioner under the Health General article, this would cover.
A physical therapist?
I don't believe a physical therapist is licensed under. They are.
I believe they are licensed, but Mr. Chair, they should be covered by this. I think you're extremely vulnerable when you're in the hands of someone who is placing their hands often in intimate areas. They could be adjusting your hips. They could be adjusting your pelvis. These are people that you expect to act professionally and not commit sexual abuse in the course of their professions. So CASA strongly believes that they should be included in this bill.
I guess I don't take issue with that. I guess my question is, these are the people who have to make notifications under the bill, though, correct?
Actually, it's anybody who witnesses it. So it's really aimed at those people who are in the room, like nurses and anesthesiologists or other people who witness these things, who are also healthcare practitioners. And
Mr. Chair, the bill does define what it means by sexual abuse. And it does, there's language in there that basically says if sexual abuse doesn't include the regular performance of whatever the general medical procedure is that practitioner is supposed to be performing on the person. So if it's physical therapy and they're supposed to guide the person by putting their hands on their hips, that's what is a part of that particular type of therapy. And that would be something that would be understood, but it would have to fall into the specific definitions of sexual abuse, sexual contact, and there are very specific definitions about what that would entail.
Is there, in the mandatory reporting, is there I'll go back and look at the mandatory reporting statute. I kind of wonder whether there's some kind of protections for or I want to say whistleblower protections or something along those lines, but I need to go back and take a look at that too. I don't see those in the bill.
That should have been one of the final amendments that we added, was an immunity clause that I discussed with one of the advocates. That's one of the amendments that should be in there. And if it isn't, I will double check and make sure that gets added. But that was one of the things that I had discussed with advocates as well, is making sure that there would be a protection so that you would not be able to be retaliated against should you
what I was going for, I guess. Yeah. Okay. I was just curious about that. So there would be an anti-retaliation or an immunity clause. Then I'll look at that amendment. I think that's something that many groups might be interested in seeing. Are there further questions for the panel? All right, Delegate McComas.
Yes, Mr. Chair, thank you. I just have a quick question for any of the folks that testified today. I thought that a mandatory reporter, that they have immunity if they come forward, and that they can't. So if they have, if that it would already be that nobody could retaliate against them or sue them or anything. Is that correct? Or does Delegate Jones need to put, some kind of whistleblower language in the bill?
So Mr. Potashnik may be able to clarify, but again, one of the amendments that we did submit, and I thought it was one of the ones that was back already that we sent around to the committee, was to add an immunity clause for any person who might report a colleague or someone else within a practice or within a hospital administration, so that they could not be retaliated against. So that is one of the amendments that I did send to the amendment office. I believe, and someone can correct me, either Lisa or Gavin can correct me, that the current protections are for persons, like if you're reporting sexual assault or sexual abuse of a patient, but it does not involve any practitioner or colleague or other staff. You're just required to, if it's a child, you're required to report that to protective services. And I believe that there are laws in place that prohibit you from losing your job for reporting that. But this is different. This is to protect you if, let's say you're the doctor or the nurse or whoever that you report is highly favored in your workplace, and you happen to witness something and you report them. This is so that there's no retaliation from your other colleagues or hospital administration or your practice for reporting someone that you essentially work with. And someone can correct me if I've omitted anything.
So Delegate, I believe that you need to have specific language that would protect the whistleblower inside of the statute. I know for that mandatory reporting for children, there's a criminal statute. So, if you don't, then you could be subject to criminal penalties. I think that's a built-in type of immunity for it. This is different. So I know that the amendment speaks to that, and I think it's necessary so that you can have that. Also, it avoids an issue where if somebody self-reports, which actually happens around the country, that person then would unintentionally be subject to immunity because they happen to self-report the fact that they sexually abused a patient. So we support all the amendments that the Delegate Jones had put out. There's a bunch, and there's some others that kind of clarify some of the language and make it a little more readable.
All right. I think there are no further questions. We thank you all very much for your testimony today, and that concludes the hearing on House Bill 1402. So thank you very much. We have two more senators waiting patiently, so let's get them out of here. Senate Bill 585 is Senator McCrae's bill. We're going to hear from Senator McCrae, and that's it. We'll hear from him for 3 minutes and go from there. Senator McCrae.
Thank you, Mr. Chair, and thank you, Mr. Vice Chair, members of the committee. For the record, Corey McCrae, legislator for this District 45, here on behalf of Senate Bill 585. Mr. Chair, I will be very quick. What Senate Bill 585 does is it basically sets up in the agency that we call GOCAP, Governor's Office of Crime Prevention, a fund to be able for our local jurisdictions to receive money to be on top of, not to supplant, but on top of, for those apprehension of warrants. We have over 200,000 warrants across the state of Maryland that's currently open at this time. There are 40,000 plus in the city of Baltimore. I talk with my colonels, I talk with my lieutenant colonels a good bit, and many of the people that they're currently dealing with warrant services have some of the most heinous acts, but there aren't any of the middle of the road pieces of it. There are a significant amount of folks that are currently on probation that have warrants out, and those folks aren't always able to be apprehended because we lack the resources necessary to be able to do just so. I work with this as a combination of my mayor, the Governor's Office of Crime Prevention, And it passed unanimously throughout Judiciary, but it also passed throughout the Senate. And this is just one more tool in the toolbox as we deal with our issues of public safety, Mr. Chair. Hope I didn't take too long.
Yeah, you're fine. All right. Any questions for Senator McCray on Senate Bill 585? Going once. Seeing none, we thank you. Wait a minute, Delegate Tolles is here. Delegate Tolles has a question.
Hello, my friend. How are you?
Hey, Delegate Tolles.
How are you? Good.
Okay.
Good. Quick question for you. I'm reading through the bill now to see if I see it. Is this just for the state's attorney's office to apply for?
This would be for our local police agencies. They're the ones that.
Okay. Yeah, they're the ones that, okay, I just wanted to make sure because I know that in Prince George, the sheriffs do the warrants.
Yep.
And I just wanted to make sure it covered them. Okay. Thank you.
Yes, ma'am.
Any further questions? Seeing none, we thank you very much. And that concludes the testimony for Senate Bill
Y'all have a blessed day.
585. All right. Senator Hedelman, sorry, you get to be the last person. We apologize, but Senate Bill 819 is here. And we'll hear this legislation right now. You have 3 minutes if you even need that long.
I don't think I do, but thank you, Mr. Chairman. Happy to be here with the Judiciary Committee. I'm Shelley Hedelman, Senator from District 11, and it's fitting that I'm following Senator McCray because my bill 819 also deals with the Governor's Office of Crime Prevention, Youth and Victim Services, formerly known as GOCAP. All this bill does is it allows the Senate to exercise its advise and consent role in the appointment of the next executive director of the Governor's Office of Crime Prevention, Youth and Victim Services. There was a very important report, the Office of Performance Evaluation and Government Accountability, OPEGA. Here it is. I brought props. It's a 200-page report, and one of their recommendations was that we should have the ability to advise and consent to the next executive director. This is an agency that is larger than 9 of Maryland's principal departments. It has a budget of over $200 million per year, 95% of which is distributed as grants. They are the funnel through which a lot of money goes through. And many of us have had some challenges interfacing with the office. And I think this just provides another measure of transparency and accountability to the next executive director. So I'm happy it passed the committee unanimously, passed the Senate unanimously, and I'm happy to answer any questions the committee may have. Thank you.
Well, that was ridiculously fast. Does anyone have any questions for Senator Hedelman? Going once. All right, we thank you very much. And that concludes the testimony for Senate Bill 819. Thank you very much.
Thanks.
Everybody, that concludes the testimony for the House Judiciary Committee for today, the 29th of March, 2022. We will be back tomorrow with bill hearings, maybe a vote session. We're trying to figure that out now.